Good afternoon, everyone. My name is Farah Douglas. I am the President and CEO of the Liver Health Foundation. Welcome to Ask Your Liver Doctors webinar. Thank you for joining us. Liver Health Foundation is a California-based foundation. Many of our board members are representing liver patients and caregivers. Our Medical Advisory Council, led by Dr. Sami Saab from UCLA, has 28 members who are some of the best hepatologists and liver specialists in the United States. Our mission is to provide updated and accurate information regarding healthcare, liver health, promoting prevention of liver disease, and advocating for quality patient care and access to healthcare. We have a very robust list of programs for 2022. Please visit our website to see the list of our upcoming programs. Our website is www.liverhealthfoundations.org. Tonight's webinar is focused on an in-depth review of liver as a vital organ for our survival, followed by an informative presentation on healthy diet for a healthy liver. I thank Dr. Sami Saab, who is the MC, the host, and the first presenter for tonight's webinar, as well as the chair of our Medical Advisory Council. We are grateful to all of you for attending the webinar and to Ms. Erica Der Sarkisian for her support and participation in this webinar. It is now my distinct honor to introduce Dr. Sami Saab, whom you all know, who is the chair of the Medical Advisory Council. Dr. Saab has been an angel for the past 6.5, 7 years. I have worked closely with him and have benefited from his knowledge, his experience, and his advice. Dr. Saab is the medical director at Flagler Liver Institute, medical director of Adult Liver Transplant Program, chief transplant hepatology, head of outcomes research in hepatology, professor of medicine and surgery, adjunct professor of nursing, professor, California North State University College of Medicine, associate editor of Liver, Journal of Clinical Gastroenterology. These are among many other titles that he carries. We really appreciate that he takes time to help Liver Health Foundation and our patients by attending and also by giving us advice. So Dr. Saab, thank you again, and you have the floor, sir.
Great, thank you for the kind of invitation to speak today. I'm gonna share my screen. There we go. And, I gotta tell you, it's a great pleasure to be among so many people today. It's a great attendance. And I feel very special to be sharing the podium with Erica Der Sarkisian. We work very well and very close together at UCLA. So in the next 20-25 minutes, we're gonna tell a story of what your liver does. So we're gonna talk about what it does, how does it function. We're gonna talk about how we assess for damage. How do we assess for disease? How do we assess for disorders? And lastly, the thing we all worry about is liver failure, cirrhosis. So we're gonna talk about how is cirrhosis defined and what are the manifestations of liver failure or decompensated liver disease. So first, some very important facts. And first of all, the liver, believe it or not, is the largest organ in the body. Weighs about 1,200 to 1,500 grams, and it performs many essential functions. And it's these functions that help maintain a good quality of life. When people have liver damage, cirrhosis, the liver could shrink sometimes. If someone's very overweight, has fatty liver, or drinks a lot of alcohol, the liver gets full of fat and the weight goes up. So these are ways that are important to estimate at the liver health. The liver has a number of functions. We're going to touch upon these right now. First of all, it serves as a storehouse or a warehouse, and it keeps iron levels and it stores vitamins and other minerals. It's also important because it stores energy in the form of carbohydrates and glucose and fat. Unfortunately, sometimes when people have a very high blood pressure, cholesterol, they're overweight, excess energy is stored in the liver, and that's manifested by excessive amounts of fat. Now, the liver also plays a very important role in detoxifying, in cleaning the blood of medications, of drugs, and alcohol. For instance, if you had advanced liver disease, if you're on the liver transplant list at UCLA or Cedars-Sinai or USC or Loma Linda, if you have cirrhosis, your body's ability to detoxify really diminishes. So for instance, if you underwent an upper or lower endoscopy, have someone take a look at the camera at your esophagus or colon, your need for medications will be much diminished because you just can't process the medication as fast as normal people. The liver also serves as a filter, takes away, harmful chemicals, toxins, and waste. So for instance, people who have cirrhosis, if the liver is damaged, the liver cannot filter things like ammonia. And so the ammonia stays in the blood because it's no longer being filtered and goes straight to the brain that causes confusion. Liver is also very important in help manufacturing. It stores protein and these keep muscles strong. It also creates bile, which is essential for digestion. Now, one of the important functions of the liver is that it maintains internal pressure. Now, this is not pressure you measure in the arm. This is the internal pressure. And so when this pressure gets to be very, very high, bad things happen. And we're going to talk about that very shortly. Now, some more important facts. Liver is very, very common. It's estimated that 1 in every 10 people at some point or another have had liver or bile duct problems. And because there's so many causes, we rely very heavily on laboratory tests to tell the difference between different causes of liver disease. And the spectrum, liver damage can be very mild, and people can live a normal life to 100 years of age, or they can have cirrhosis, liver cancer, and need to be placed on a liver transplant list. Here's a list of common causes of liver disease, and some of these you may have already heard about in your doctor's office or on the news or on TV, like viral hepatitis, like A, B, and C. As you know, we've had a number of outbreaks of hepatitis A in Southern California among unhoused individuals. In San Diego, there was a huge outbreak about 4 years ago, and many people died of hepatitis A. Autoimmune disease, where the body's immune system attacks the liver. Metabolic problems, where there is too much iron or copper. Excess copper is called Wilson disease. Cholestatic, which means that the problem in the liver relies at the level of the plumbing, the bile ducts. And we call this primary cirrhosis or primary cirrhosis cholangitis. Liver disease can also be caused by medications. Now, the good thing is, despite the many medications we take, the many medications that are available to us, only a fraction could cause chronic liver disease. Any medication can cause, a transient elevation. Medicine like Bactrim or Septra, even stuff like Motrin, Napers, it can cause a transient elevation liver test. But to cause permanent damage, fortunately, is very rare, very rare. And then another cause of liver problems is liver cancer. Now, if you look across the United States, the most common cause of elevated liver test, of liver damage, is fatty liver and alcohol. Hepatitis C is listed here, but to be honest, hepatitis C is really falling off the radar screen. Many people with hepatitis C have been treated and cured, and so hepatitis C as a common cause of liver disease really depends on the population we're seeing. So how do we assess? This is probably the hardest thing we face, monitoring, diagnosing. We rely on laboratory tests. Occasionally we require liver biopsy, but this is fortunately not very common. Imaging, we may require ultrasound or CT scans or MRIs. We may ask people how they feel. These are called symptoms. Are they tired? Are they fatigued? Are they itchy? I saw a lady today who's very, very itchy, and she probably has recurrence of her primary sclerosing cholangitis. And also for signs. Signs means physical findings. Are their eyes yellow? Is the belly swollen with water? Are the ankles swollen? These are all signs of advanced liver disease. Now, in terms of laboratory tests, the one we always look at are what called the liver enzymes. And these are namely two, the ALT and AST. And this indicates that there's some liver stress. And I tell people to imagine balloons in the room. If you poke a hole in the balloon, air leaks out. Same thing, we have liver damage, these enzymes leak out. And measure that on routine blood tests. These are other laboratory tests, bilirubin. If it goes very high, your eyes turn yellow. Albumin is a protein made in the liver. It's very important because it's a good marker of liver function. And it's also a good marker of nutrition. And hopefully Erica go over. And prothrombin is a clotting factor that's also made in the liver. And this is also a major indicator of how the liver is working. So what does hepatitis mean? My mom hears hepatitis. She thinks something very infectious. She thinks that it's contagious. But hepatitis just means inflammation of the liver. Like tonsillitis means inflammation of tonsils, appendicitis, inflammation of the appendix. Hepatitis just means that there's some stress to the liver. And it can be caused by, again, medications, alcohol, fat, or virus. And if it's a virus, we give it a letter, A, B, or C. So those are kind of generalized tests. We might use more specific tests. Like for hepatitis C, we have specific blood tests to diagnose hepatitis C and hepatitis B. We have blood tests to look for cancer. These are tumor markers. So here's a test of hepatitis C. Elena's on the board director helped us screen, for instance, at Homeboy Industry. We screened 100 people at Homeboy Industry for hepatitis C using these quick tests to get the results in 15 minutes. And in terms of how much liver damage we have, the old standard used to go the liver biopsy, which we do not really do anymore. We could use elastography on upper right-hand corner, which tells us the liver thickness. You also have blood tests called serum biomarkers, those also amount of liver damage, or imaging like CT or MRI or ultrasound. So these are different ways we can assess for liver damage, other than the common blood test. Ultrasound, this is a way to look at the liver shape, how thick it is. It might tell how much fat there is as well. It also used to screen for liver cancer. People with cirrhosis are at risk of developing liver tumors. And other tests like CT MRIs are also very, very helpful. And we do this in cases where there's something suspicious in the ultrasound and we want to confirm it on a CT or MRI. I didn't mention this, but people when they have cirrhosis are at risk of liver cancer. That's why we do the ultrasound. And they're also at risk of developing swollen veins in their esophagus, namely esophageal varices. So as standard of care, anyone who has cirrhosis undergoes ultrasounds on a regular basis, and they also undergo an upper endoscopy to look for any swollen veins. So now we're going to talk about liver complications. On the upper left-hand corner, you see a healthy liver, and it takes many years for a virus, for diet, for fat to cause cirrhosis, many years. And then after someone's cirrhosis, they may be at risk of liver cancer. So one of the things that we want to assure people that things do not happen overnight. It takes many years for evolution. This is a kind of a summary slide. When people have cirrhosis and may develop high pressures, we call portal hypertension. That's a slide I showed initially about the pressure. And this is internal pressures being elevated. This leads to problems in the lungs, leads to vomiting blood, which we call varicose bleeding. It may lead to ascites, which is water retention, and hydrothorax means water in your lungs. And then when you have liver insufficiency, the liver not only causes high pressures, but it doesn't work very well. It doesn't make proteins. It doesn't clear the blood. And so that you get jaundice, you get coagulopathy and low protein in both portal hypertension. Oh, sorry, both portal hypertension and liver insufficiency can cause encephalopathy confusion. Now, I do want to recognize there is a question, and one of the questions someone asked is, can the liver regenerate? And that's a great question, because the liver is one of the few organs of the body that regenerates. Now, there is a point of no return. If someone's got yellow eyes or they're swollen belly, they're vomiting blood, when you have signs of portal hypertension, the liver probably cannot regenerate. But we have people who have cirrhosis from hepatitis C or alcohol, hepatitis B, their B or C virus gets treated and stop drinking, and they can have reversal of liver damage. In that sense, they have regeneration. But unfortunately, there is a point of no return. We don't know what the mechanism of regeneration are, but we do know that it's very helpful. For instance, if Elena needed a liver transplant, I could give her half my liver. The liver I give her will go to her normal size in 6 to 8 weeks. In my old liver, the one that's left behind, would also regenerate to normal size. We don't know why the liver regenerates. We don't know why it starts regenerating. We don't know why it stops regenerating. But it's a fascinating question. So when people have cirrhosis, advanced liver disease, people that Eric and I see quite a bit, we worry about the long-term effects, and that can include muscle wasting, fatigue. People who have trouble with the filtering excretion and have confusion, yellow eyes. And from elevated pressure mentioned earlier, portal hypertension, they get water retention or swollen veins in their esophagus, and also liver cancer. So you have to watch for all those complications. So cirrhosis just means that the liver is very, very, very hard. So a normal liver is soft like a sponge, but when it gets cirrhotic, the liver gets firm and hard, and instead of the surface being smooth, it becomes bumpy. It becomes very bumpy. So if you have cirrhosis, there's less healthy tissue working, and so people can feel fatigued and tired. We have to make sure not to excuse these for other things. Now, these are some of the signs, physical findings of cirrhosis. One is a spongioma or angiomata, where it's a little red spot people have on their upper chest, backs, or arms. These are signs of cirrhosis. There is a differential for this. People when they have sun exposure get small spongiomas in sun exposed areas. Yellow eyes, jaundice, they get red palms, and that's because aspiration where the hands flap up and down. Here, someone's got yellow eyes and jaundice, and this is due to elevated bilirubin levels. We mentioned the jaundice, and here's signs of pressure derangements. On the bottom is it's a gentleman who has cirrhosis. The big belly is all that is free water. You can put a needle and drain the water. And the upper part of the right-hand screen is a vein and esophagus spurting out blood. Here's someone from the VA hospital that had fluid removed. You see on the left-hand corner, it's a big belly with the belly button sticking out. Upper right-hand corner is a needle going into that belly, all done through sterile technique, hooked up to machine and with a drain fluid off. I mentioned the veins a couple of times. These are pictures of the veins. And if these veins are very large, on the right-hand side, you see us putting rubber bands on the veins, getting rid of them. Let's see. So people, when they have cirrhosis, they have cramps on their lower extremities. Usually wakes up at nighttime. It's got a knife ripping through muscles. You have itchy skin. Itchy skin, the problem is itchy skin, as is very variable. It can happen, because of medication, allergies, different soaps, shampoos. But when people have liver disease and we hear about itchiness, usually starts off at nighttime when they go to bed. And then over time, as itchiness gets worse, it carries over during the daytime. But itchiness tends to start at nighttime. So when people have cirrhosis, we practice preventive medicine. I mentioned screening for liver cancer a couple of times with ultrasounds and blood tests, screening for varices with endoscopy, recommend a low salt diet because when you have a salty food which retain water, and that leads to a swollen ankle, swollen belly. We avoid shellfish like clams and oysters because this can shellfish can be associated with the bacteria called Vibrio, be very dangerous. People when there's cirrhosis, they have cirrhosis, they are starving, they're malnourished. We want to make sure they don't fast and they have to exercise on a regular basis. Here's a picture of an ultrasound with the mass, kind of the white hazy area. And the right-hand side, you see a CT on the top, MRI on the bottom. Both have an error point to something that should not be there. Both these were unfortunately liver tumors. The treatment, well, the treatment really depends on what's causing liver disease. If it's hepatitis B and C, want to treat the viral infection. If someone's drinking alcohol, stop the alcohol. And we want to treat the symptoms of fatigue, water retention, confusion. But at the end of the day, when someone's got very advanced disease with portal hypertension, liver insufficiency, the ultimate therapy is a liver transplantation. To keep your liver healthy, we want to minimize, actually want to avoid alcohol. Studies have shown that there's really no safe amount of alcohol to drink. Eat healthy, eat regularly, and get vaccinated against hepatitis A and B if you're naive, because when people have liver disease, if they get hepatitis A or B on top of their liver disease, it can be very catastrophic, and avoid alcohol completely. So at this point, I want to stop. And I think there was one question I didn't answer. Do some medication cause worsening liver disease? It's a good question. The list, unfortunately, is very, very long, but there are medications that can cause liver problems or worsen it. The ones that come to mind are, certain antibiotics, but, it's hard to predict which one. And the ones that the most common ones are amiodarone. The most common ones are going to be methotrexate, which are not commonly used. So at this point, I want to stop here. Thank you for your attention. And I'm going to introduce my good friend and colleague, Erica Der Sarkisian. She's a registered dietitian nurse dietitian at UCLA. She's certified, has ample experience both at the inpatient and outpatient setting. She's local. She received her bachelor's from UCLA and earned her master's degree from CASA Los Angeles in nutritional science. They're very fortunate to have her at UCLA, where she helps specialize in nutrition optimization in liver and intestinal transplant recipients, and works as our senior dietitian at the UCLA Flagler Liver Institute. The nutritional needs of our liver patients is a subject of many inquiries, calls, and emails. So I think we're very lucky tonight to have such an esteemed speaker. Erica talked about nutrition, liver disease. Erica, I'll pass the podium to you. Thank you.
Thank you so much, Dr. Saab. It's a pleasure to work with you and a pleasure to present with you today. Let me go ahead and share my screen. And so, hi, I'm Erica. For the rest of this webinar, we're going to be covering what and how to eat for a healthy liver. So I'm a registered dietitian. I work at UCLA. I work with mostly end-stage liver disease patients, and I just help optimize their nutrition however I can, whether it's weight gain or weight loss, poor appetite, helping control blood sugars, and optimizing any micronutrient or electrolyte levels. I have no financial interests or relationships to disclose. So there's three main sections we're going to cover today. In the first part, we're going to be talking about the basics, so liver and nutrition basics. Then we're going to dive into a little game called Fact or Fiction. And this is going to be some of the most common diet and liver related questions that I get. And last, we're going to put all this information together and think about how to make these recommendations practical when you're actually at the grocery store or thinking about meal planning. So let's get started. As Dr. Saab just mentioned, the liver plays so many different roles in the body. After eating food, our liver goes to work, helps digest the food, stores and releases energy and micronutrients, so vitamins and minerals. It also helps maintain blood sugars, and it helps protect us by creating proteins that support our immune system and removing toxins from the blood. So to talk about how to support our wonderful liver through diet, we first want to look at some of the diet-related factors that can contribute to damaging our liver. When we look at the risk factors and the stages of fatty liver and liver failure, we can see this pretty clearly. So how does a healthy liver become a fatty liver? The liver converts any simple carbs that we eat in our diet. So that can be sugar or processed grains like white rice, and that turns it into fat. Body fat in our body also is releasing fatty acids into the bloodstream, which then travel to the liver. And so over time, the liver starts to store fat into its cells and become enlarged. As fat builds up and the liver becomes inflamed, this can lead to NASH. And further down the road, many years, we can get irreversible scarring or even liver cancer. Risk factors for developing NASH include being overweight or obese, having pre or type 2 diabetes, having high blood pressure, or having high blood cholesterol. But the good news is that a healthy diet can actually address all of these risk factors and can actually help reverse most of them. And as we can see, weight loss can actually reverse some damage to the liver. So what does this exactly look like? Well, it looks a lot like following a Mediterranean type of diet, which is considered kind of the gold standard when it comes to diet for lifelong good health. I don't actually love the word diet because it's so often associated with calorie restriction, and that's not exactly our primary goal here. What we're looking at is an overall pattern of food choices that we make, and that can actually have a huge effect on our liver health. So I know I just spent some time talking about fat in the liver and our goal to decrease it. So it may surprise you that you see healthy fats as the first food group listed. This is because healthy fats actually have really wonderful anti-inflammatory properties, which can actually help combat inflammation. We're talking about extra virgin olive oil, fatty fish, such as salmon, tuna, or sardines, avocados or avocado oil, and nuts and seeds or nut butters. When it comes to fruits and vegetables, variety is definitely key, meaning we want to just fill our plates with different colors of fruits and vegetables. So we say, eat the rainbow. And the reason for this is because different colors in fruits and vegetables actually signify different phytonutrients that are found in that fruit or vegetable. And we know that these phytonutrients can have a lot of anti-inflammatory, antioxidant properties. For example, anthocyanins that are found in blue, red, and purple fruits, like blueberries or grapes, for example, can actually help decrease fat accumulation in the liver. Lean proteins are very important as well. When we say lean protein, a lot of the time people go straight to meat, but it doesn't actually have to be meat. A lot of vegetarian and vegan sources of protein can actually be really great lean choices. For example, eggs, beans, lentils, tofu, nuts, seeds, nut butters, all great options. You can incorporate meat as well. We want to go less for red meat, more for leaner cuts, chicken and turkey. If you are choosing beef, more leaner versions. And yogurt is a great source of protein as well. Also a great source of probiotics, which we know can fill the gut with good friendly bacteria to help fight toxins as well. Whole grains, definitely want to choose whole grains over processed white grains. The reason for this is that higher intakes of whole grains and dietary fiber has actually been associated with lower risks of developing that liver cancer and dying from liver disease. So always make sure to check your nutrition labels and ingredients here. This can be a little bit tricky. Sometimes they take white bread and dye it brown to make it look more whole grain. They also use tricky names like multi-grain, which basically just means they used a lot of different types of grains versus whole grain, which is whole grain, using all the parts of the grain. And so This is something we want to check. Just the best way to kind of know is to just check that nutrition label, look at the fiber content. If it says greater than 3 grams or 3 grams or more, you're in a good place. If you look at the ingredient list, 100% whole wheat is the first ingredient we're looking for. Herbs and spices are also great, have a lot of anti-inflammatory properties: cilantro, parsley, turmeric, cinnamon, garlic, and ginger, which can be used as a spice. And these are just not only taste really good, but also really good for your liver. So definitely add these to your foods liberally. We'll talk about supplement forms of herbs in the next section. So we talked about what to eat. Now let's talk about how much to eat. And so this is when the healthy plate method really helps out. It really simplifies the process by showing you what your plate should look like. We really want half of our plate to be filled with vegetables. Remember, a variety of vegetables. This can be a raw salad or cooked, steamed, baked vegetables. Doesn't mean we want to do half a plate of French fries though. As you can see, some vegetables like potatoes, peas, and corn are actually what's called starchy vegetables. And that's included in our starch section of the plate, about 1/4 of our plate, along with any whole grains like whole wheat bread, whole wheat pasta, whole brown rice. And this doesn't mean you shouldn't eat them, that they're terrible, but they are complex carbs, but just 1/4 of our plate. And the last 1/4 is going to be our lean protein, which is so important for not only immunity, for maintaining lean body mass, and just helping keep us full. So how you can apply this is if you're thinking of doing, for example, pasta for dinner tonight. Instead of eating a whole plate of just pasta, we can make it more well-balanced by choosing a whole grain pasta, adding a lean protein like chicken or ground turkey, and then adding that side salad in to fill half our plate. So now we know what to eat. Let's talk about what to try to limit or avoid. Now, I want to clarify, this isn't necessarily you can never have any sugar or fried food. Everything is about balance and moderation, but just knowing what these foods are can help. So as Dr. Saab already mentioned, excessive alcohol can lead to more buildup of fat, inflammation, and scar tissue in the liver. So it's better to avoid. Added sugars can actually also cause fat buildup. So we're looking out for things like high fructose corn syrup in the ingredients, even things like honey, agave syrup, juice, jams, fruit jams, and fruit jellies can also be included in this. Fried or fatty foods, this is a really high, usually higher in what's called saturated fat. This is the less healthy type of fat, and this can lead to inflammation and scarring over time. So better to avoid fatty red meats, processed meats, fried chicken, French fries, onion rings, and as much as possible, try to choose baked, steamed, different versions of cooking. Salty foods, we know that too much salt can be damaging. So look out for really high salty foods like soy sauce, pickles, again, bacon, sausages. These tend to be some of the highest in salt, but always check that nutrition label and try to limit adding extra salt. You can definitely use some of those spices and herbs we've already discussed to help season foods, because we don't want to be on a bland diet, just a low salt. And as Dr. Saab already mentioned, if you have cirrhosis, definitely following a low salt diet can help control that fluid retention that can sometimes happen as a complication. Last but not least, shellfish. So as he also mentioned, shellfish has a very high food safety risk. And so it can lead to what's called a foodborne infection, which can sometimes hospitalize you or even worse. So it's better to limit these if you have any kind of cirrhosis. And honestly, if you have any kind of immunocompromised thing going on, it's probably a good idea to be careful with shellfish. So in this section, we're going to be doing some myth busting. I've put together 3 of some of the most common questions I get. Some may surprise you. These are questions from the internet, and we're gonna separate fact from fiction. So organic foods are healthier. What do we think? This is actually false. And so that may surprise you. Let's talk about why. Let's start with talking about what organic means. So organic foods are regulated by USDA, and it must be 95% organic to carry that seal, that USDA seal. The soil has to be free of most synthetic pesticides and fertilizers, but natural pesticides can be used. Animals are not given any antibiotics or growth hormones. They're fed organic feed, and they're able to roam outside. What it doesn't mean is that they have any more nutrients, vitamins, or minerals than conventional or non-organic produce. So both organic and conventional food is within the level for safe consumption for everyone. So this is important because, you know, if you want to eat organic, there's no problem with that, but we want healthy eating to be accessible to everyone. And if you can't afford organic food, that doesn't mean that you can't safely incorporate fruits and vegetables into your diet. There's also no higher risk for bacterial contamination for these foods. So both foods are very safe and healthy. Next, there are a lot of herbal supplements on the market that claim to help detox the liver, cleanse the liver. So are these a good idea? No, the correct answer is false. So unfortunately, herbal supplements are not as regulated, and mislabeling is extremely common, meaning they might not have what they say on the label. The claim that they can cleanse or get rid of toxins hasn't really been proven, and some may actually harm your liver and lead to liver injury. There's a website, LiverTox, it's a database. It has over 1,000 herbal and dietary supplements that have shown to be somehow toxic to the liver. A lot of people think, you know, if something is natural, it's safe, and that's not necessarily always the case. We know a lot of bacteria and fungi and plants actually produce poisons and toxins and chemicals. So if you ever have any questions, you're not sure, always check with your doctor or healthcare team before taking anything, even if it's over the counter or natural, and take vitamins and minerals as prescribed as well. All right, last but not least, coffee. So the media loves to talk about coffee, and it seems like every day we have, you know, a headline about what that's the best thing for you or if it's the worst thing for you. And so what's the verdict? It's true. So coffee is actually really wonderful for your liver and has been linked to lowering risk of developing fatty liver, cirrhosis, and even death. To get the most out of this, it's recommended to drink at least 3 cups per day if you can tolerate it. I know for some people that leads to sleeping less. So, you know, use at your own discretion. But there's a new study that came out in the past year or so that actually showed that this benefit was present for decaf, instant, or ground coffee. So that's the good news, is that any of these can actually help. And as always, disclaimer, if you have heart or lung problems, check with your doctor first, because this much coffee might be a little harmful. And I want to end this section with just some tips so that when you are online and you're seeing health information, you kind of know what we're looking for. And so we're always trying to be a little bit skeptical. And so one thing we're considering is profits. Is something being sold to you? For example, if you're on a website and you're reading about all the benefits of this herbal supplement, and the website is for the company that's selling that herbal supplement, that may not be the most reliable source. Are there any brand partnerships or funding? Sometimes something's not being sold to you, but that person or company has a partnership or is funded by another company. And so, for example, influencers on social media are often paid by companies to promote an item. So this is something that we have to keep in mind. Speaking of social media, what are your sources? Is it a trusted source? So How much do you trust a stranger on the internet? What are their qualifications for giving dietary or medical advice? If you're reading an article, does it cite studies to back this up? Are the participants in the studies human or rats? What's the sample sizes? So sometimes the study is done on 10 people with a certain gender, certain age, certain population, doesn't mean that it's always going to be recommended for the general public. So I hope that was a little helpful. Let's put it all together. When you're at the grocery store, preparation is always key. So try to plan ahead as much as possible for your meals for the week using everything we've learned. You can make a grocery list to kind of help keep you on point, and definitely don't go hungry, because we've all been there where we're starving and we go to the store with a plan to buy a couple things and we end up with a cart full of things that we didn't need. So, and we know we don't make the best choices, especially food choices, when we're hungry. So try to eat something before. When you're meal planning, consider adding seasonal produce to keep the costs down. And don't be afraid of frozen produce. This can be just as healthy as fresh produce, and usually more cost effective. Just look for any added ingredients, any added salt, but as long as it's like frozen peas, just as healthy. And then check nutrition labels and ingredient lists. This is just a good habit to get into, just to check and see what's in it. Anything that comes in a box or a bag or a can will have that label on the side. And this will help you make smarter choices. And this was requested multiple times. So I also wanted to include a list for food swaps. These are simple substitutions that you can make to make healthier meals and snacks. So instead of vegetable oil or butter, choose extra virgin olive oil. If you're cooking high heat foods, avocado oil is a better choice. Instead of fried chicken, go with baked chicken. Same with all fried foods. Again, occasionally fried food is okay, but it's about patterns, overall patterns. Pancakes with syrup can be replaced with a whole grain French toast using whole grain bread, egg, and cinnamon. And you can add blueberries on top for some added sweetness. Always replace processed grains with whole grains. So high sugar cereal can be replaced with oatmeal. Vegetables and hummus can be a really great healthy snack and gives you that crunch if you're looking for something like that instead of chips and dip. Popcorn is a really great whole grain snack you can incorporate. Always try to go more stovetop or air popped popcorn versus the type that comes in the bags, the microwave popcorn. Those tend to have a lot of added salt as well. And if you're like me and you love sour candy, you can actually try freezing grapes, which can make a really good sour kind of snack. And soda, a lot of sugar, can be replaced with sparkling water, which I know it doesn't taste the same, but it has some of that carbonation. So it works for some people. And that's it for me. Do we have any questions?
I think there's a very good question here.
Sure.
That someone from the internet was looking and asking about detox information. There's a lot of people talk about detoxing. Is it good for you, bad for you? Should they invest in that?
Yeah, that's a good question. So as you mentioned, our liver and our kidneys do a great job of detoxing. We don't recommend any added supplements to detox, further detox. And like I said, in the myth busting section, they can actually sometimes cause more harm than good. Do you agree with that, Dr. Seth?
Oh, for sure. And I like what you said about coffee. Coffee's been shown to be beneficial for alcohol, fatty liver, hepatitis C. And here's another question. What do you think about fasting? Is that good or bad for your liver, fasting? That's a loaded question.
We don't recommend fasting, especially if you have any blood sugar or you're on insulin. We definitely don't recommend it. But actually, the liver likes more frequent meals because the liver actually does a really, one of the roles, as we talked about, is storing energy. And so when the liver is not working as well, that process is not working as well. And so we need to give more frequent meals to the body. If you do have cirrhosis and stage liver disease, we actually recommend eating right before bed as well, as a lot of that muscle wasting happens overnight. And so if you can have something right before bed with calories and protein, it can kind of give the body something to use instead.
Excellent, excellent. Another question, a very good question that we were asked quite a bit is about stress. Can stress cause liver disease? And the end and anxiety, and the answer is you probably could, not directly, but indirectly by making you eat more, by making you drink more. People have talked about how sometimes autoimmune conditions can be precipitated or exacerbated by stress and anxiety. It's a very good question. Erica, here's a good question by Elena, and she's asking, do probiotic pills have the same benefit as eating foods that have natural probiotics in them? So probiotic capsules.
That's an amazing question. Yeah. With probiotic pills, there are certain things that we look for a good probiotic. One of the things is we wanted to have at least 1 billion, I think, colony forming units. And we're looking at the genes that are most studied. I, as a dietitian, always prefer food sources. So yogurt, kefir, sauerkraut, these are really good food sources of probiotics. I always feel like there's more, food is made up of more than just its elements, so it's always better to get things from foods than pills, in my opinion.
Yes, I agree.
Yeah, so try to go for natural first. And then if you want, you could talk to your doctor about adding a probiotic pill.
And how about yogurt? Is that a good source of protein and probiotics, yogurt?
Yeah, it's a great source. Yeah.
I told our patients to have a Greek yogurt at lunch because I think there's a lot of probiotics in that, and like you said, it's natural food.
Yeah.
And here's a question from Farah about milk. That's a hard question. Is milk good for your liver?
I wouldn't say it's good or bad. It's a good source of protein. There's a lot of studies out there on milk. So I would just say, if you like it, try to limit to like a glass a day. Try to go for fat-free or skim milk as much as possible versus the full fat, which can be high in saturated fat.
Yeah, exactly. I think it all makes a big difference. So Erica, any final remarks before I pass the podium back to Farah?
No, I mean, I think I covered most of it. Just like we said, it's all about patterns. It's not always about, people always say like that they feel that, oh, they ate one cookie and now they have a bad diet. And I always tell them, if you are always eating junk food and you eat one salad, does that make you healthy? No. Well, it's the opposite too. If you're always eating healthy and you eat an occasional, fried food or something, that doesn't make you an unhealthy person.
Yeah, that's funny. So that's good.
Patterns matter.
Yeah, that's excellent. And I think something you've highlighted is it's very important that we all work as a team. We're lucky to have you at UCLA and the Liver Institute. I think our patients benefit from your expertise. So thank you for coming, Erica, and I'll pass the podium back to Farah for closing remarks.
Thank you so much. I had one question for Erica, and you didn't mention salmon. I've heard so many good things about having at least two salmon serving in a week. Is that correct?
Yeah, we did in the healthy fats section. We talked about fatty fish. And so that includes salmon, tuna, sardines. These are really good sources of omega-3 fatty acids, which are very anti-inflammatory, good for the brain, the heart, the liver. And so I definitely agree with that recommendation. Yes.
Great. Thank you so much. Thank you, Dr. Saab. Your presentation was fantastic. Thank you, Erica. We learned a lot tonight, and as you know, we are recording this program, and we will be, of course, putting it on our YouTube. On February 23rd, we are planning to have a webinar on liver cancer. So please visit our website to see the complete list of our programs that are coming up. As I mentioned before, this year we have a brand new series of webinars. We call this Patient's Journey. In each of these programs, which is going to be once a month, one hepatologist will sit down with their own patient and they have a very informal conversation. In all these webinars that we do for you, we give you a lot of medical information regarding liver disease, how to keep your liver healthy. In a liver's journey, a patient's journey, we sit down with the patient and the patient tells us how they feel when they found out they have liver disease, what they've gone through for tests and treatments and where they are right now. We have had 2 of those this year and they've been very popular. We've had young 12 and 14 and 9-year-olds that participated in those. We will be doing that once a month, so please look for our announcement on those. Thank you again for joining us. I hope you enjoyed and learned some new information about liver and how to keep our livers healthy. Thank you, Dr. Saab. Thank you, Erica. Thank you, Laurie. And thank you, everyone.